So what actually is hip arthroscopy? So hip arthroscopy is a minimally invasive procedure where we could place a fiber optic camera inside a patient's hip joint, generally done through 2 or 3 very small keyhole incisions. It allows us to place this fiber optic camera in the hip joint without causing any damage, and we get a bird's eye view of the entire hip joint. Your hip joint's a ball in a socket, and on the edge of the socket you have the labrum, which is a piece of cartilage. A lot of times that'll be torn, so during the procedure we can fix the labrum and reattach it to the edge of the socket. Generally we'll use what are called suture anchors. Suture anchors are these small screws that are made out of calcium and bone, which will dissolve over 2 to 3 years. We really are not using metal screws anymore. And once we fix the labrum, we'll generally have to address a bump or an extra piece of bone on the ball side. We call this impingement, and it allows us to go in and shave down the bone and make it nice and smooth. So this way, when you go to flex your hip, the bone is not hitting the cartilage anymore. The whole procedure is outpatient. You go home the same day. It takes about an hour to 2 hours to do, generally done in an outpatient facility. After the operation, you go home, you'll have to use crutches. Your ride home will be comfortable because your leg will be numb, you won't be having any pain. Once home, you'll be sent a couple of machines. One is a CPM, or a continuous passive motion machine. It's a machine that moves your leg, and we generally like to start that the day of surgery, and you'll use that 3 hours a day. And you'll generally also get an ice machine, and the ice machine will be placed right over the hip and circulates cold water and ice over the hip joint, which helps reduce pain and swelling, and hopefully will reduce the amount of pain medicine that you have to take after surgery. Generally, we'll see you back in the office in about a week. Then we'll start physical therapy. Rehabilitation is extremely important. It's critical to everyone's success. You'll generally do physical therapy for about 2 to 3 months. You'll do it about 3 times a week. We tell people no impact activity, no running, no jumping for about 3 months. And generally, within 3 to 5 months, most athletes and most athletic people can go back to full sport.